Now our tint went perfectly and we didn't have any contra-actions, but if your client did get some tint in their eye or they did take a reaction mid-treatment, then what you want to do is stay calm, don't panic, take off the tint residue in the same way that we did with the cotton buds, working quickly and explaining to your client what you're doing. And then you'll have cold water in a bowl. Ask your client to tip their head to the side and then load up a cotton disc with water. Squeeze out some of the excess but not all of it. And what we're going to do is an eye flood or an eye bath where you very gently squeeze water over the eye, and what it's doing is it's cooling and soothing the area and it's helping to flush out any tint residue that's causing that problem. So you would keep doing that until the client starts to tell you that they feel that there's some coolness or they feel that the sting has gone away. And when that's finished, just take your dry cotton pad and just dry off the area. Now, to warn you, this does have a tendency to go down past the temples, possibly into the hair, but if your client does feel uncomfortable and there is a sting in that area, they won't mind, they just want that tint removed. So if you need to do an eye bath or an eye flood, that's how we do it. And then you just finish off as normal, dry off the area. You might even want to give your client some cotton wool just to dry it off themselves, because sometimes your client can get into the area better than you can. But that's how you would do an emergency eye bath if there's some tint within the eye. So we've successfully tinted our client's eyelashes and eyebrows, and we're now going to do an eyebrow shape. But if for any reason there was some tint on the skin, you can use tint stain remover. And you use this with a cotton bud, and it's just a clear liquid. So you'll dip your cotton bud into the liquid, you'll apply the liquid to the area where the tint stain may be, and you'll just take your time trying to work it out of the skin. You can then use some cotton pads just to keep moving over the area to see if the stain removes. And when you're quite happy with it, you'll dry off the area, but then you'll go back over it with a cotton bud that has water on it, and that way you're making sure that there's no tint stain remover residue on the skin, and then just dry off with a dry cotton pad, and that way your client's good to go.